Everybody come and sit down. We're ready to start this. Well, thank you. Thank you.
Yep, I'll do, yeah, I will.
So, thank you
All
all
right,
for
just because I'm gonna have to kind of shorten the course, I'm just gonna get started.
Yep.
It's normally 2 hours, but I'm gonna try to do it as fast as I can in an hour. For those of you who want a certification. My name is David. I work with Medic 2 Foundation. We are a community-based CPR teaching organization that is a part of the Seattle Fire Department. So I typically am employed by the Seattle Fire Department. What our other branch is Medic 1. I don't know if you guys have ever seen the ambulances that drive around with Medic 1 on the side. Those are paramedics. Paramedics are what we call sidewalk doctors. They are somewhere between a nurse and a doctor, and they give all of our advanced life care out in the field. Some cool facts about King County: we actually have the highest survivability rate in the world. If you have a witness cardiac arrest here, pretty cool. It's actually not because of us. It's actually because of you all taking this class. We have the most what we would consider average civilians trained in CPR, highest percentage of any county in the entire world. If you have witnessed cardiac arrest that's non-traumatic, you have a 60% chance of living in King County, which is absolutely absurd when you realize that the average national benchmark is 15.5%. So it's pretty crazy. I remember learning that in my EMT course, and I couldn't believe it. But now that I've worked in emergency medicine for 5 years, you can see it. Every time we show up, someone is at least trying CPR, and that is just not normal, super rare. So thank you for taking this course. You're part of it now. A little bit about me. I worked in emergency medicine for, like I said, for 5 years. I was an EMT for a few years. I worked in the NICU at the same time. So I had my fair share of babies. I love working with babies. I also worked in postpartum, labor and delivery, and I now work in the emergency department. I'm a code technician and an ortho expert. So I do all the splinting and with the doctors, and then I also do all the CPR for my whole hospital. So I do a lot of this. I'm pretty good at it. I like to think, at least. So I'll try to teach you what I know. I'm going to skip some slides here that are unimportant, so don't worry about that. We don't need to go over history. What does CPR stand for? Anybody know? Nailed it. Nice. Cardio is for heart, pulmonary is for lungs, resuscitation means revive. Basically what we're doing is we're trying to pump the heart for somebody so that we can provide blood, oxygenated blood, to our vital organ. In this case, we're particularly talking about the heart itself, circulating blood through the heart itself and the brain. Brain and heart tissue, they don't regenerate. Our whole life, we have the same musculature tissue in our heart and our brain for the entire time. Well, after puberty to the day that you die. And so it's really important that we keep them oxygenated and keep them having blood. If not, you can cause an anoxic brain injury, which sometimes does happen after someone receives CPR. So it's important to really quickly. I have a bunch of slides that say that, but we'll just go over that now. Act quickly. Every minute you wait decreases your chance of survival. So important that we have someone doing compressions as fast as possible. If you are uncomfortable doing breaths at any point in your lifetime, or if you encounter CPR, just don't do it. It's okay. We will do the respirations. We are trained to do it. We have devices for it. I will do respirations on a random person because I'm trained to do it. Some other people out there might be as well. Leave it to the people that are comfortable that do it at this job. If you're uncomfortable, it's not your loved one, just don't do it. Just hit their chest for us as long and as hard and as fast as you can. That's all that's going to matter for us. Are cardiac arrest and a heart attack the same thing? No. Why? Give me a quick answer.
One's a blockage and one's electrical.
Yeah, what's a blockage?
Well, the black is just
No, which one's a blockage?
cardio infarction.
Yeah, myocardial infarction. Yeah, you get extra points. Yeah, cardiac arrest is also called a myocardial infarction, which is what a heart attack is also called myocardial infarction. We colloquially call it a heart attack. It's a circulation problem, right? There's a blockage in one of the vessels of our heart so that it can no longer pump blood to itself. If a heart attack is unchecked, if it's untreated, it will result in cardiac arrest. Because if your heart is not getting enough blood to all of those tissues that pump for itself, it will eventually shut down. But technically, a cardiac arrest issue is an electrical problem. You no longer have a functioning, what we call SA node, which is the electrical regulator of your heart. It could also be your AED node, but one of your nodes is no longer functioning. And so that it can't pump for itself. It's unable to do that. A heart attack, I want everybody to know this because we have a very aged population. Symptoms are hard. Anybody know? Anybody know what the symptoms of a heart attack are? Very important.
Tightness in chest,
Yeah.
jaw,
Yes, in women especially, jaw pain.
back pain, nausea, and
Yep.
left
Left arm pain, beautiful. Yeah, love that. Jaw pain is a really interesting one. Unexplainable jaw pain in women is a super common sign of a heart attack that is missed. Women actually die more from heart attacks than men do by a considerable margin. So make sure that if you're worried, just come to us in the ER and get checked out. I do 25 EKGs a shift, and I'm happy to do it. If you think you're having a heart attack, we want to treat you. It's easy for us to give you an EKG, run your troponin blood test, and get you home. That's fine. We'd rather you get checked out than not get checked out. Crushing chest pain, shortness of breath, especially doing normal activities like walking, like you normally do. Now you can't breathe when you do it. That's a problem. All right, we're going to spend some time on that because that's important. All right, I'm going to break it down into 5 steps. Okay, 5 steps for CPR. We'll kind of walk through them really quickly, and then I'll go over respirations real quick, and then I'm going to let you practice because that's the important part. I'm going to show you infant CPR, and I'll let you practice with your extra time at the end. Does that sound okay for everybody? And of course, I'm going to go over the AED. I might save the AED till the end though, because I kind of want you guys to practice the CPR itself first. Okay. Should we rush into a scene when someone's down? Say I find someone out in the street. Should I just run up to them and help? What do you think?
You want to check for.
Y'all are too nice. No, absolutely not. I'm not going to rush into a scene with no idea why they had a cardiac arrest. They could have been shot. They could have had some sort of traumatic event. Electricity can happen. It could be some sort of electrocution. You don't want to be a part of that circuit. It could be any sort of thing that you don't understand. If it's ever on the street, that is not your job. You do not try to help somebody in the street if you are not a firefighter or a law enforcement. That is our job. Please don't do it. If it's your loved one and you can drag them off the street, you're more than welcome to do that. But please do not help someone in the middle of the street if you are not safe. There have been several times in my career already where someone has tried to help someone in the street and they themselves have become a patient. So please do not do that if you're not safe. We want you to look up, down, left, right, behind you, make sure everything's safe. When we practice, I'm going to have you do this cheesy thing where you say, the scene is safe. And I'm going to have you look around because it's important that you're recognizing and thinking about actually doing that when you're out in the wild. Our second step is going to be checking for someone's responsiveness. Does anybody have an idea of what we could do first? Very first thing I can do.
Oh, breathing.
Say it again?
Hold them. Are you
Absolutely.
okay?
Yeah, you don't even have to touch me yet. Are you okay? Sir, ma'am, person, are you okay? You gotta yell loud, right? Like I'm yelling, if you yell quiet, like, oh, yeah, you okay? Someone who's sleeping, that's not gonna do anything. I'm out like a light when I sleep. If you just yell at me with a light voice, no way I'm gonna wake up. If you wanna yell at them first, what's the next thing we can do? I heard someone say it earlier.
check the right fingertip.
We'll get there in a second. Okay, shake them. We say tap on the shoulder because tapping your clavicle, if you tap your clavicle like this, it's kind of uncomfortable. It doesn't hurt. It's just like weird. It feels weird. So we tell people, tap the clavicle right here. Are you okay? Are you okay? If you really think they might be asleep, we recommend that you do a sternal rub, but only do that if you're comfortable doing that. You can also press up in people's ears if they're really asleep. It hurts real bad. If you push right on the top of the jaw, they'll wake up real quick if they're sleeping. But tap on their shoulders. Are you okay? Are you okay? So they're unconscious and they're unresponsive. What should we do now?
Oh, 911.
Beautiful. You're on it. You guys are great.
She's a nurse.
Please call 911. Whenever you find someone unresponsive and unconscious, you have to call 911. If that is all you can do, because that is all you're safe doing, is calling 911. Call 911. You've done your job. If you're not even safe enough to touch the patient, just call 911, please. Our response time is generally less than 5 minutes, depending on where you are in the building. So please call 911. We'll get the job done. If you can't, put your phone on speaker. Stay calm. I know it's a stressful situation, but if you're rapid firing words and we can't understand you on the phone, it's going to be really hard for us to help you. So just make sure you're speaking loud and clear. It's okay if you're shouting into the phone. Dispatchers don't care about that. Just make sure you put it on speaker. They'll walk you through everything. They might ask you, is there an AED within your site? That's the only reason you alone would go require an AED, you have multiple people. One person can call 911 and put the phone next to you for you, as long as you know someone's doing it. And then one person could go grab the AED and they can go searching for it. So you've got help, right? I would recommend always 2 people stay with the patient. You are required to have 1 person stay with the patient. Always have 1 person stay with the patient, but 2 is great. 1 person go with the AED, that's awesome. Next thing we're gonna do is check for breathing. We do not check pulse anymore. People do it wrong all the time. I can tell you firefighters do it wrong sometimes, or someone who works in the hospital. So please don't go for the pulse. If someone is unresponsive or they are not breathing, they meet the clinical requirements for CPR. That is all you need. And if they are conscious, they will push you off. And it'll be fine, and you're protected by the Good Samaritan. So unresponsive, and then we're gonna check for breathing. The way I check for breathing, out in the field, you get down low and you put yourself in a position where you can do everything at the same time, because you want to do this for no more than 10 seconds. We recommend between 5 and 10 seconds. I'm going to tip their head back with their chin, and I'm going to put my face next to it so I can feel it, I can hear it, and I can see their chest rise. Chest rise is usually very obvious if someone's on their back. You're going to see their chest rise. Now, it doesn't really matter what size they are. Their chest is going to rise pretty evidently when they're laying on their back. Make sure you do open their airway, though. It's possible their tongue is just back in their airway. You open that airway, you might solve it. So go ahead and just tilt their chin up and from their forehead and from their chin, tilt that back. You can check for breathing. What's next? We've already determined that they're unresponsive. We've called 911. We checked their breathing, so we're going to start CPR. Okay. I'm going to go through the steps here. Can everybody put up their non-dominant? Like that. Cool. This is the normal, traditionally how people do it. You can push up the hand if you want, but we're going to put the non-dominant hand down. We're going to put the dominant hand right over it. We're going to straighten our arms all the way out, and this is the hand position. They say that this is okay. I disagree. I think it's really uncomfortable for your hands. You can do it for a couple if your hands are getting tired or like your nails are digging into your hand or something like that. It's okay to do this for a few, but it's inefficient. If you ever watch movies, they do it like this. God, it's so bad. Don't ever do this. You want your pressure all in one line, right? Where's my pressure here? It's in two lines. There's one here and there's one here, right? We want our palms right over each other because that's where all of our pressure is going to be, is on the heel of our hand. So make sure that they're directly over each other always. Great picture for body positioning. What's bad is using less muscles. So if you want to think about it logically like that, right? If I'm far away from the mannequin, I'm out here, I'm going to be just using my shoulder muscles. This is so inefficient. Don't do this. If I'm sitting down here and I'm close, I'm still just using my shoulder muscle. But if I put my chest, the center of my chest directly over the center of their chest, now I'm using all of my weight, and I can actually just use my hamstrings, and that's all I have to do. I'm going to lock my arms out. I'm just going to move this. Cool. To find the center of the chest, they used to say nipple line. Everybody's got different bodies. Okay, everybody's nipple line is going to be different. So we actually are going to go from their axillary region or their armpit. You're going to put your non-dominant hand, like we said, across the body in their armpit and drag the heel of your hand until it reaches the center of the chest, which is the sternum. Most people have a pretty easily recognizable center of their chest, and you can approximate it with the center of the neck as well. For men that have pronounced Adam's apples, that's really easy. It's just to work it down. Cool. That's how we find the center of the chest. Put your heel of your hand there, and then press. Does anybody know the BPMs? You're disqualified. Does anybody know how many beats per minute we want to do? 120? Yeah, 100 to 120. Great. We'll do that in a second. 100 to 120 beats per minute. It's roughly 2 per second, but you're not going to be, getting the stopwatch out. So just make sure you're going as fast as you can. I still use Staying Alive. It is just so perfect. It's got a nice rhythm. It has a nice melody that's easy to remember in your head. A lot of people use other songs. There's a lot of modern songs now that I like tell high school kids and all that. There's, if everybody likes Uptown Funk. Yeah, unfortunately, Another One Bites the Dust is also good. It's a little on the low side, but it is good. Uptown Funk, if anybody knows that song by Bruno Mars, that's also a good one. I just feel like that one sticks in my head really well. I always sing a song in my head when I do CPR to this day. After dozens of times, I still do it. It just keeps me focused, keeps me engaged, keeps me from losing my head in a scary situation. So please do that if you need to. It's not weird. Cool. Any questions so far? I know it's a lot. I just want to make sure we're We're feeling good. Good so far? Okay. I'm gonna go with rescue breaths because I want you guys to practice this if you want. If you're getting a certification, I just want to see you do it once or twice. If you're not getting a certification, play around with it if you want. Totally up to you. So we generally just teach hands only for people not getting certifications down. We do our breaths. If we are doing breaths, I'm gonna put the mask on the stencil over it. In the wild, like I said, I only really want you doing breaths on people that you love, right? After COVID, it's a little risky to do breaths on a stranger. I think it was risky before COVID, but now, especially after COVID, it's a little risky. So make sure that we are being safe with that. And if you have this, you can use this. It's more of a practice mask, but it is effective if you want to keep it and use it. They also come in those packs. There's one that looks like a keywords not good, BBMs. No, okay. They're like that. They're like a little mask that's like shaped like this, and they have a little tube on it. You can use those as well. Those are effective. They cover both the nose and the mouth. With this kind of thing, we're not covering the nose.
A lot of times you'll find the mask in with an AED, right?
Yes, there are a lot of masks in AEDs. There should, if not, they're so cheap on Amazon or a supply store. Just go buy one and put it in your ear. They fold up real nice. You can also put one of these that are more not made for practice in them as well, or 4 or 5. So like we said earlier, we're gonna do that head and chin lift. So I put my hands here, or the side of my hand at the forehead, and then I lift with my other hand on the chin. And then with my 2 fingers here, I'm gonna pinch the nose. If we don't pinch the nose, air goes right back up the nose. So we're gonna pinch the nose. We're gonna do 2 big breaths, and it's only gonna be 2 attempts. If you miss one of the attempts, doesn't matter, do compressions. Compressions are way more important. If you witness this person go down, they still have like 6 to 7 minutes of oxygen stored. So I'd rather you do compressions and get the oxygen blood to their brain and their heart than try to fumble around with respirations that you might not be confident. But I want you guys to practice it because it is kind of fun to try it. The most common mistake is not opening your mouth wide enough. You really have to encapsulate their entire mouth. So you'll see me open my mouth all the way and I'll cover the entirety of this little mask. If you decide to keep your mouth over the patient before you do the next breath, you breathe in through your nose. Just saying, not everybody's gonna think about that in the moment. Or you can tilt your head away. That's fine too. We're gonna do 30 compressions and 2 breaths. That has not changed. Any questions about respirations? If it's not working, let me know. I'll come and try to show you how to do it. Make sure you can set nose tight, okay? Open that mouth wide. Cool. No questions? You guys are great. Okay. Just while we're at this, child CPR. When I say child, I mean 2 years old to the onset of puberty. Onset of puberty, you're looking for things like body hair, BO, physically large child. You can treat that as an adult. So when we talk about CPR, clinical adult, it's somebody who has gone through puberty or started puberty onto the child CPR. The only thing that is different is the pressure in which you press onto their sternum. So if I was compressing, our friend right here, I would use a lot more force than if I was even compressing you here, right? You just have to be relative to your body size, your strength. Make sure you change it. If I'm compressing a 3-year-old, I'm probably going to go down to 1 hand just to remind myself to press with less force. If you want to go with this method, if you feel like you're going to press too hard, you put 1 hand down and you put your other hand here to stabilize yourself. And I guess for a 3-year-old, it would be more like. Okay. You want to go 1/3 of their chest height. That's your estimation. Not going to be able to really see that very well, but it's harder than you think. Go as hard as you can at first, and if you want to lighten up, if you feel like you're crushing too hard, you can bring it up. Cool.
Also just at the end of life, if somebody's 80 or 90 or something.
Okay. Yeah. Most people, I would say, over the age of 90 probably don't want compression, but that is not your job to know that. It is your job to know that when you're a DPOA of your family member. That is your job to know that. The power of attorney, designated power of attorney. If you're the designated power of attorney and your parent or loved one has requested that you do not resuscitate them, that is your responsibility to know. However, is your family member going to sue you? Probably not. So I wouldn't worry about that too much. And it's not your job to know someone's DNR in the field. You have implied consent to aid anybody who's unresponsive and unconscious despite their advance directive. So please help if they need it. You don't know if their advance directive is, that's not your job. Cool. Another question I get all the time, are you going to break ribs? Yeah, it's a real thing we should totally talk about. First things first, you're definitely going to break cartilage. So I still remember my first compression ever, I really do. Because you press down and it feels like you're cracking your knuckles all over someone's body. That's kind of what it feels like and sounds like. That crack is breaking cartilage. So you're going to break all that cartilage that's surrounding the sternum that connects the ribs. You may break a rib on an older patient, but you probably won't break like snap ribs in half if you're thinking about that. You might fracture them a little bit. You might tear some cartilage. I would rather have some torn cartilage than be dead. So it does not matter. Push as hard as you can, save the life, and then we'll worry about the broken ribs in the ICU later. Cool? What we're looking for when we stop, to stop CPR, there's two scenarios. Either somebody takes over for you that has equal or greater training, or someone has signs of life. And you guys can see this, right? I'm not watching this. I probably won't. Or we see signs of life. Signs of life need to be very, very obvious. They need to be talking, coughing, spontaneously breathing normally, or moving, coordinated movement. Like they are intentionally doing something, not jolting, right? Sometimes you're doing compression so well that they might get a little bit of movement in their arms back. That does happen. If you stop compressions and they stop moving, they still need them. Does that make sense? People ask all the time about vomiting. Vomiting is not necessarily a sign of life. You might be doing good enough compressions to where their stomach now has enough blood in order to use a diaphragm to vomit. That is totally possible. Turn them on their side so that they don't inhale that vomit, and then put them back on their back and continue compressions. Vomiting happens a lot during CPR because we might blow air into their stomach rather than their lungs. Sometimes when you're blowing air in, some of it goes into the stomach. We see people vomit in codes in the hospital all the time because we're pumping all kinds of air devices into them, and sometimes it goes in the stomach. That just happens. Cool. We're going to show up and look for pulses and blood pressures, but you guys don't have to worry about that. The Good Samaritan law is going to protect you. If anybody doesn't know about the Good Samaritan law, feel free to ask me about it later, but just know you're completely protected. You cannot be sued. The only thing that's a little weird is you can't take monetary compensation for your services. If you take monetary compensation for CPR services, then you now are subject to, I can't remember exactly what the law is called, but you're subject to quality of care laws. You're now subject to HIPAA. So if I were to help somebody on a plane, I would accept nothing from anybody. That's what I always tell people. If they're trying to give you free flights or anything like that, you still technically can't accept it unless you're confident you're not going to get sued for anything, maybe. But you do incur the HIPAA laws if you accept compensation in any. I mean, you can accept free food or something like that, but not like flights that have large monetary value. Cool. All right. I want you guys to practice. Do we want to go over the AED before we practice? Then we just do all the practicing at once? Or do you want to practice and then I talk about the AED? What do you guys think? What do you think?
Why don't you practice this and then
Fresh.
Yeah.
Okay, practice first. I love it. Let's practice. Okay. Everybody come to a mannequin. I think I have at least one for every two people. I want you all facing the screen, facing me. And we're gonna be on the side of the patient, of course. Actually standing first so we can do our scene safety and our checking first office. Okay. And then the other person can wait in the chairs or wait with them. Don't be shy. It's not that bad. It's not that bad. We're just gonna start with the scene safety. I'll let you guys go on your own time, but I want you to look around, say the scene is safe, which is Mickey, but please do it. And then, you can skip the yelling part of the responsiveness, just tap them on the shoulders. Are you okay? Are you okay? And I want you to check for breathing for no more than 10 seconds. And then, call 911. And then start CPR. Is that okay? Yeah, or just tell someone to call. That sound good? Okay, go ahead and start on your own time. I'm gonna come around. If you feel like you're not doing it well enough, just raise your hand. I'll come help you out. 30 compressions, 2 breaths. I want you to do 4 cycles. 4 cycles. No.
Compression.
Check what that is. Compressions first, breath second. Start whenever. Go.
The theme is okay.
What about? Are you okay? Yeah, it has to be done. Are you okay? Are you okay? Are you okay? Okay.
Yeah, there you go. Great.
Are you okay?
Now you look at your chest. And then listening.
Start with compressions. Always 30 compressions first. Did you all call 911?
Oh,
Did we call 911? Good.
Call 911.
Good.
There's no one here.
Some of your mannequins have lights. If you have 2 greens, you're doing it perfectly. If you have a red, it means you're probably not going fast enough or deep enough. And if you have yellow, you're not doing one of them. So you're either not going fast enough or not going little fast. I don't think you. I'm sorry. I think this one's out. I noticed that.
And then.
Bring your knees all the way down.
And then.
Yeah, that's good.
Is that too fast?
You get 2 greens with a yellow in the middle. That's too fast.
Okay, I don't see any lights here.
You may not have lights, or the battery might be dead. Keep your thumb all the way straight. So you don't get the
That's fine. I gotta see what.
Put all your voice together with it.
Because I'm on the street.
Rip them off, put them in your pocket, you know what I mean?
You're down.
Yep. Your arm completely. You want to lock it. You just want to do your best.
Well, I'll go out there a lot.
You can go on either side. I just wanted you guys to face me so I could see.
You're so bad.
So sorry.
But say it a lot.
Don't do it longer.
No, yeah.
It's not even a credit.
So by then- Okay. Okay.
Nice, nice. Nice work, my friend. That's great.
Yes, right. Yeah. So I'm straight, I'm put. Oh.
Yeah, it's like being harder.
Nothing, shoulder, no.
Like it's simulating things in the back of the. So they have that. Nice. It's fine. That's right. Yeah, I just wanted you to read it 3 or 4 times. Whenever you feel comfortable. And you can run it up.
That has to be 30, sorry, I wasn't counting.
Perfectly, and I'm feeling it.
Make sure everybody's gone. Make sure you swap. Make sure we swap.
Good job.
I know it's tough,
Okay, so it's now.
but just remember that doing something is better than nothing, right? So if you can at least just press the chest a little bit, you're at least pulling the heart a little bit, and that'll help. But if someone comes along that's stronger than you, let them take over. Let them take over.
Yeah.
You stop until someone takes over. You go as long as you can.
Did you want to turn?
Someone taking over. I will tell you, I have never seen
I
someone.
decided not to. I don't want
And I have,
With my
I
folks.
would just, I have never seen it.
to. Okay.
Yeah. You almost always get a shot. Almost.
Yeah, don't worry about that.
Go through the motions. Those parts stuff, because it's sort of drive, and you compress them, and sort of drive back. Don't do that. Overdose are kind of the only place that we don't.
So you're going. Now it's stop. You're seeing.
Go take a shot. Yeah, good question.
Yeah,
Any questions? You feel good?
yeah,
Something you hope you never do. Yeah.
Is this much?
yeah, it's like things, back in the school days, it was
The same.
15.
No,
It was 30.
but you can't do anything. So that's not.
No,
It's, I would say it's similar. The chest kind of flies up on the dummies, which does not happen with us, but. Yeah, my chest wall doesn't pop off, but, yeah, it's actually decent. Yeah, sometimes you'll see like dockers that get in there, rather than sweeping your finger in, like I said earlier, you pull it on the side. And if you need to sweep with a longer side, I'm okay with that.
Yeah.
So you're sweeping in.
yeah,
You never.
those days,
You never
they
want to.
didn't have, external.
And always on the shallow end, never try to go. Always.
The,
And to be honest with you, if you.
bring out the big,
I mean, it's better than getting
big
used
toe
to constant shallow.
with the,
We even tell people,
Yeah.
don't walk. Some areas are, in almost, there's not.
That's a little, I'm sure it requires a lot more training than,
yeah,
than one class. Yeah, for that.
Some. Everybody feel good?
yes.
Yeah, it's a good question. I'll tell you guys. No, I'll address it now. You guys want to sit back down for just 1 minute? I'll show you 2 more things, then I promise I'll be done. So we'll start with the AED because I know you guys are really interested in that. I have a practice one here, and I heard you guys have bought a new one, which is super exciting. I love that. Just so you know, King County will check your AED if you contact the King County defibrillator line. If you just look up King County automated defibrillator line, we can check it for you. I'm pretty sure it's free. Don't quote me, but I'm pretty sure it is free. Also, if you want to register it with Pulse Point, we would love that. Pulse Point is an app that you can get. Pulse Point AED and regular Pulse Point. It's an app on the Google Play Store and the App Store. The AED app shows you where all the AEDs in your surrounding area are. Anyone who's registered their AED. It's pretty awesome. I love that app. If you're ever in a bind anywhere and you need an AED, you're at home, you're in public, you can find it right on the app, and it'll show you every AED in the nearest mile of you. It's pretty amazing. Pulse Point AED and regular Pulse Point. Pulse Point, if you decide to turn your notifications on, it will notify you when there's an active CPR event anywhere within a quarter of a mile. You can turn it off very easily. You know, if you download the app, it won't automatically turn on. You have to turn on the notifications. And if they think that bystanders will be there sooner than EMS, they will send a notification out. I've used pulse point 2 or 3 times in the past 5 years to get on scene first. So it's very cool. It's part of the reason we have such good evidence. Cool. That's a bit about the apps. AEDs, they're so easy to use and they're not going to shock you. That is what I want everybody to take away from this. They are so easy to use. There are instructions in every single pack. Mine doesn't have instructions. It's the class, but and instructions on how to use them in every single pack. And the 911 operator can tell you exactly how to use them and walk you through the steps because all of them are firefighters or ex-firefighters as well. So they know what they're doing. The AED Pulse Point app also has all the steps of how to use an AED on their main menu. So if you ever need it rapidly, you can also pull that up. Pretty awesome. And we've got the internet. So many ways to see the steps of AED. I'm going to go through them with you anyways. Step 1, turn it on. Make sure you turn it on. You're going to be really nervous. Make sure you turn it on. I'm going to turn this on. I'm going to let it kind of talk through while I talk. Sorry for the double talking.
Press the child button.
So some of these will have a child button.
Remove clothing from the patient's
You're going to press the child button and use the child pads
and
if you
apply
have
pad
it.
on the patient's
Okay.
skin.
We have to bare their chest.
As shown in the pictures.
You have to bare their chest because these pads have to go directly
Remove
onto their
packet
skin.
and apply pads on the patient's bare
Once
skin.
you bare their chest, if there's a lot of chest hair on the patient, you are going to have to shave it if the pad doesn't stick. So if it sticks and it doesn't come off, that's good enough. Put it on there, leave it on there. But if it sticks and you can see that it's like folding up or coming off, you have 2 options. You can either take that pad, wax them because they're really sticky, just wax them real quick, and then put a second set of pads on. Or most AEDs will also have a little tiny razor blade. Do a rough job, you might cut them, it's fine. Just scrape it off enough for a small circle, at least that much, to where the AED can stick to the center of it. Most people don't need that kind of treatment, but I encounter some people that do. Once you turn it on, you bare the chest. You've pulled them out of standing water. So if they're submerged in water, you need to pull them out because the AED won't work as well if they're in water. Obviously, if their chest is wet, you might have to dry it off, right? Dry it off so the pad sticks. Then you're going to plug the pads in. Another step is often forgotten. Make sure you plug it in. And the pictures will show you exactly where to put the pads. One's going to go in the top right part of their chest, and one is in the bottom left of their ribs. Okay, we like to say Washington and Florida. Keeps it easy. Washington, Florida, if you're looking at my chest right.
As shown in the picture.
Sorry, Washington, Florida. My bad. Washington, Florida, right? Once you attach the pads, you see how the machine is repeatedly telling me, put the pads on the skin, put the pads on the skin. If your pads aren't secure enough, it will continue to say that. So you'll know if they're not secure enough. Once they're secure enough, the AED is smart enough to know that I'm right. The only time you can stop CPR, you're allowed to stop CPR, is if this machine tells you to. It's going to tell you stop, analyze the alarm, or analyze their rhythm. It might say no shock. And so I'm going to immediately start CPR again. I'm not going to wait. I'm not going to talk about if we should do it again. If it says no shock advised, I'm immediately starting CPR again. And they'll give you a metronome, which is pretty awesome, right? You got a metronome here, and it's going to tell you when you've done a full cycle of CPR, which is nice too. But like that, 32 breaths. Obviously, if you're a little behind, do your 32 breaths, but you can sync up with it if you like. So you're going to keep going until it analyzes again, which will be in 2 minutes. It can analyze every 2 minutes. Sometimes it won't analyze until every 5 minutes, depending on the machine or depending on that initial rhythm. The rhythm is shockable. It'll tell you shock advised, stand clear, charge. So it'll tell you that the shock is advised. You'll say, don't touch the patient. If I'm the CPR person or I'm the one operating the AED, don't touch the patient. And it'll say shock advised. It'll make this awful noise. It's like most AEDs, it's like it's a terrible noise or a loud scream, like a loud piercing scream, which is good, right? It's telling you when it's going to shock. The shock button will flash or it'll glow up on your machine potentially. And you're going to make sure you're clear and you're going to push the shock button. And then you're going to immediately start CPR again. You might see their body kind of jolt a little bit. That doesn't mean they're back. Even if you might get them back, just continue to do CPR until you have those signs of life, like I said. I was just telling somebody, I have never seen a case in my career yet, other than with overdoses, where I have just given someone compressions and they've came back. They've always needed a shot. So make sure that you use the AED if you can, since you're trained now. And you'll notice the first thing we do when we show up is we're gonna bring our AED in and put the pads on immediately. While you're putting the pads on, another key note here, don't stop CPR. So I'm gonna be doing CPR and someone else is gonna be putting the pads on and just maneuvering around me. I might move my hand a little bit. They might have to get real close to me to put it on, but continue CPR until that machine tells you to stop. Okay? Any questions? Yes.
So are you gonna go through the motion, like, how do, when you started?
Yes, yes, I will.
Okay.
Yeah.
Okay.
Yeah. So I was gonna do one full scenario with you guys, and then I guess should be good after that. Any questions at all, other than that?
Does that one go below the ribs or on the lower ribs?
On the lower ribs,
On
good
the
question.
lower ribs. And it's wrapping, did you do it kind of sideways? So it's
Yes, that is kind of irrelevant, but yeah, as long as it's on the lower part of the ribs.
Okay.
What we're doing is we're making a line on directly through your SA node that I talked about earlier. Your SA node is kind of like the higher medial portion of your heart. And you want that line to go straight through it so that it shocks it and just jumps it like a car. That's basically what it's doing. It's going to stop it so that the heart can spontaneously have electricity.
So that pad will pull the hair off the first time, and then if you have a second.
Normal pads, these ones are very deep. Don't use these as your reference. Normal pads are very stiff. So if you do feel like the pad's not staying on, or if this machine keeps yelling, put the pads on, put the pads on, put the pads on, but you have the pads on, it might be the hair. So if you have 2 sets of pads, wax them with one. If you don't, you only have 1 set of pads, carefully remove that pad, shave the hair, and then put the pad on. Does that make sense?
Do we have multiple pads in those? I think we just have one set of shelf and one set of.
In case of emergency, you can use the pee pads and wax, the child pads and wax them. But the hair freaks everybody out. Usually it's not a problem. I think like my level of hair, maybe you might need to wax, but I don't often see people with this problem. So don't worry about it too much. It's a rare case. Those pads are so sticky that they're going to grab onto the seams there.
The pads seem to expire really quickly. Is it a year or 2 years that they say they're expired? Are they really useless at that point? Should we throw them away? Should we keep them to use as waxing? Should
Great
we-
question. They do expire about every 3 years, I believe it is. I think that's the ones in the hospital are. What an expired medical adhesive product means is that it is no longer 100% effective. Does that make sense? It could be 95% effective, 96% effective even, but it's not 100% effective. I think that to have a fully functional AED, you should have non-expired pads,
Well, sure,
but
but.
I don't think you should throw them away. I think you
Right,
should
I mean,
keep them
From
and
the
use them as
churches and streets,
tools.
We have stacks of expired pads because we've had this AED for a while, and so should, like, how many should we say? We're not gonna have more than one at a time,
Maybe save 2. I don't think more than 2 is necessary. Yeah.
but they might be useful for waxing.
Yeah, for
So
sure.
I can share some with the community club, I mean, like.
Yeah,
so-
waxing, yeah, absolutely, that's good.
Like waxing.
Exactly, yeah.
Cool, so I unfortunately don't have someone who's with me to show me, but to show you exactly how it'll go. But normally what'll happen is during that 911 step of the CPR, I'm gonna say, go call 911 and grab an AED for me. I don't see many scenarios where I'm actually gonna do it myself. If you guys are standing in this room for sure, and it's like hanging on the wall right there, it's a sure, I'm grabbing it, I can see it, I'm gonna grab it. But you need to start CPR first, as a non-compressed heart that has no blood flow through it is not going to be shockable. It's going to be what we call asystole. It's not going to be shockable.
Really, it's a 2-person job.
It really is. That's why I always recommend using 2 people with the AED, because you're really not going to do much by yourself. You can quickly grab it and slap on the pads yourself and then start the CPR and turn it on, and maybe it'll analyze the heart. But you want to do a little bit of CPR before it analyzes so that you have some blood flow in it. So I'm going to be doing CPR. You have to kind of imagine with me for a minute. Unless anybody wants to volunteer to come do CPR for me. Anybody volunteer? You were great. You want to try?
Sure.
All right. What's your name? Leandra. Leandra. Nice to meet you. So Leandra's going to do compressions. Just go ahead and start. He's already done his steps. He started the breath or checked for breathing, called 911, told me to get the AED. I returned with the AED. He's probably been doing compressions now for 30, 60, or 90. I'm going to say, hey, I have the AED. I'm going to put the pads on, okay? I'm just going to start putting pads on while he's progressing. Turn it on. Without the very good chest. You can put them upside down if you want to with the wire going up, that's fine.
When you get in the picture, that pad firmly on the skin. Do not touch the patient. Analyzing our drill.
The respiratory stuff, or just?
Let's just say this is an instance where he's not comfortable with it.
Okay, strange.
Okay, now don't touch the patient. I'm gonna tell him, don't touch the patient.
Begin
Said no shot.
CPR.
Advise. This is actually a really good time to switch. So if someone's getting tired, say Andrew's getting tired, Andrew, I'm gonna swap away from this side. Okay? Time. Now it's a quick demo, but I'm not working a ton of time. So I want you guys to try it once before we go. Cool.
So, one question, you do it 30 times, and then do you breathe, and even with your shocking, or?
So you can do it's just like normal. So think of the AED as an additive, right? You are not going to change your CPR steps. You're going to continue doing 30 compressions, 2 breaths the whole time. 30 compressions, 2 breaths, 30 compressions, 2 breaths. The only difference is that the AED tells you to stop, you stop. And then you resume right where you left off. That makes sense?
Or somewhere where there isn't any numbers to bear check.
Technically, no. If they're wearing a puffy coat though, like in the winter now, you should take that off because that's going to affect the efficacy of your compressions. Thank you, Andrew. Great job.
I just want to say CPR works, because I had CPR for Whistler by my husband and a passerby for 45 minutes for the A parking. So,
Yeah, that's incredible. Thank you for sharing that.
With the AED.
Yeah, that's wonderful. Thank you for sharing. It really does work. I have done CPR on someone for an hour and 25 minutes, and I got them back. And I actually makes me a little emotional because I just got to say goodbye to him today as he left the hospital. So it's pretty cool. It does work. As long as you're compressing and getting that blood to someone's brain and heart, they can have a life afterwards. They can have a high quality of life still. So the faster you do it, the better. I want you guys to play around with the AEDs if you have time. If you got to move on, I get it. It's okay. But I would love if you guys could come up and practice the AEDs. The last thing that I had for you was just choking and infant CPR. I can go over infant CPR with those who want a certification right at the end after you guys practice the AED. Does that sound okay?
Yeah.
Okay, go ahead and practice the AED real quick. I have 4. I'm sorry, that's all I've got. And I've got the steps up here too, if you want to look at it. Don't be afraid to look at the steps. Picture someone starting CPR. Picture we're running through CPR while we're doing it, so you can get that practice.
Okay, I will be in charge of it.
Oh, you've been.
Well, for like, are you start CPR.
Oh, it's great. Make sure you get it clear.
Firmly on skin.
Time to switch.
Advise.
I know what I always like to tell people, even if you're accidentally touching the patient, you will probably not get shocked. I have actually touched with a patient and the doctor did not clear me. And they stopped the patient and it felt kind of like a elevator shock. It wasn't that bad. I really don't recommend it. I really don't want you to do that. Make sure you're clear, but it's not gonna kill you. Okay, great. Once you guys feel like you're doing that, make sure everybody wants to practice it. I want you guys all tested out. Pretty easy though, right? Like the steps are pretty easy. That's what we like to tell people about AEDs. They're very simple. Don't be afraid of them.
Place where they hope not. Is there?
Poor guy. In real life, I would not.
Yeah, that's fine. If you want to, yeah.
It's telling us, and then it's not telling us first we are.
I think so.
You're so late.
CPR.
You can turn it all the way off. Did you hold the green button down? If you just press it once, you can pause it. Press it again.
Oh. Okay, that's trying to get this out.
Great impression.
I'll grab the AED.
All right.
Turn it on.
You wanna try it?
Oh, I need it. I need it again. Okay.
Yeah, it's hereditary.
Sorry. All right.
Yeah, grab burrito or something.
Like getting out of the kayak. Are you okay? Okay, hold my one.
Burrito.
You know. You don't want to touch that?
Not even clear.
She's not messing around. They're like 17. Guys, the AED.
The AED, are you gonna do the AED? You want me to do it?
It doesn't, it means that the heart rate really that heart
Where's the other?
Yeah.
There too.
only a couple times.
Well, there's two stuck together. I should.
You pull from the bottom.
Got it. Oh,
So
okay.
basically,
Yeah, technically this should be called a semi-automatic. Whereas it's not, you have this manual information. We do have automatic.
Do not touch the patient, analyze.
stand clear.
It's analyzing.
Don't touch the patient.
Oh, here it shows.
They're telling you, listen.
Yeah.
Do not touch the patient. Everyone clear.
Yeah.
You touch, yeah, clear.
CPR.
Okay, CPR.
We'll
CPR.
about where.
Well, you agreed to.
No, it's telling you to do CPR, not breath.
Did you want to?
You want me to press for you?
You can stand by it all night.
Okay, 2 breaths. Two breaths.
It said 2:30.
I don't, it's just set 2 breaths.
Like a 6-year-old.
10.
There's always.
10 compressions.
Like a little bit. I feel like it.
No, 15 or 20.
No, it says 20.
30. 30 correction.
Give two breath.
Two breaths.
Oh, yeah.
All right, I think you did it, Mom. Good job.
I think that's.
Okay.
Now I have to get up.
These are the same numbers. You make them the same way. Yeah. No, it's very fast. Most kids, like middle schoolers, is like the threshold. Like middle school, you see like 3/4 of them still can't really compress it, like 1/4 of them can. And then you get to high school, they can basically all do it. But the lung bags are the lung bag, the way we use lung bags now are very.
week ago. I had it in my stock.
All I can say is,
You guys are welcome to roam, but I just wanna like dismissively talk about choking real quick.
Yeah.
okay,
Uh,
Tiffy, Tiffy.
I'm just gonna talk about choking real quick. Choking is really important because it's much more common with CPR. If someone's choking, they're gonna be in distress, right? They may run to the bathroom, they may change the color of their face really rapidly. And most people will grab their neck like this. It's just universal. People just do it. If that is true, I want you to go up to that person and say, are you choking? Which seems silly, but they could be messing around. Are you choking? They're gonna nod yes. Can I help you? Yes. I've only ever had one person say no. So they're gonna say yes. You're gonna step behind them. We call this abdominal thrust now because Dr. Heimlich is not a good dude. So we call it abdominal thrust. You're gonna get an athletic stance behind the person with your leg between their legs. And I'm being athletic stance because if I can do abdominal thrust like this, I'm falling back. And that's not gonna be good. So athletic stance behind. I am going to find their belly button from behind. Unfortunately, these mannequins, the bottom is the belly button. But you're gonna find the belly button, and I'm gonna put my non-dominant thumb in a fist, just like this, with my knuckles up. I'm gonna put my thumb directly on the belly button, put my other hand over, and I'm gonna go up and in a J motion. If that makes sense. It's gonna be like this. When I do abdominal thrusts, I actually kind of get low and then rise with the patient. I find it to be easier and it gives a little bit more pressure on the upward motion. So I go like this. And I move upward. If it's a child, get on one knee. That works. Put them right here. Thrust like this. If they're significantly larger than you, have them back against the wall, preferably not with the bench. Have them back all the way against the wall. I'm gonna put my fist with my knuckles facing in the same spot right above the belly button. I'm gonna push in and up like this, right? I mean, if I have to do abdominal thrusts with someone who's 6'5", I can't do that. I'm 5'10", that's not possible. So you have to have them stand against the wall and put your hand just above their navel and press them down.
Don't they have to be standing up straight also?
Standing up straight.
Like the patient has to.
They need to put their back against the wall, all the way against the wall. If choking, if you are unable to dislodge that item, they're gonna fall to the ground, right? They're gonna go unconscious and you're gonna start CPR. Very simple. If they're falling, don't try to catch them. Just protect their head. Someone who is completely limp is so hard to catch. Do not attempt that. Just try to protect their head if you can. If you can't, we'll worry about that later. But then you start CPR. Yes, that's it.
So is it different when you're behind them? It's just above the navel, but if you're doing it with the.
Sorry, it's just above the navel for both times. I usually just find the navel with my thumb like this, right? And then I move my hand directly up it. Right.
You know, my mother was choking once at a family dinner. And I tried CPR, didn't work, and my sister-in-law was a teacher, came up and said, stand up straight. And then she was able to do it. But my mom was kind of hunched over the sink when I was doing it.
Yep, you want them to stand up
The
straight.
patient has to stand
You want them to stand up straight so that you can thrust it in. Also, if you're really having a hard time, try the wall method. I did the wall method to my dad 3 years ago, and it worked first time. First thrust, the grape came out.
I had a 2-year-old that got swallowed a lifesaver and it got stuck in her throat. Not my child. but, the person I was with went to do CPR the way, or not CPR.
Abdominal thrust.
And she did that and it didn't work, and I picked the child up and turned her with her
Mhm.
face facing down and pulled on it. It was as hard as, her stomach was as hard as brick. And finally, it loosened and she spit it out.
Yeah,
So
what you can
Is
do,
it typical that your stomach is hard?
yeah, because you're bracing your core, right? You don't know what else to do. It feels right to brace your core I'm like using my muscles to try to get it out. You don't know what to do, right? Especially if you're a 2-year-old. What you can do to make that better is have them cough. And when they do that beginning part of that cough, they obviously probably aren't. If they have a full blockage, they can't bring any air in. They have partial blockage. When they go to come in, they'll be completely relaxed in that moment. So then you can thrust.
I saw a 2-year-old right outside here who just choked on a grape and he was limp and on the ground.
Yep, CPR.
It was terrifying, but the mom did the sweep and hit him on the back, and then we called 911 and they came and he was just sort of in and out of consciousness. It was just the scariest thing I've ever seen.
Well, my one correction to that, never, ever, ever do the sweep. That I guarantee you that sweep that she did pushed the object farther.
Well, she just kind of.
Do not do not do a sweep
No
ever.
sweeps, okay.
If you can see the item at the tip behind the teeth and you can grab it with 2 fingers and pull it out, you're allowed to go inside the mouth. Or if there's vomit and you're wearing a glove and you're on their side and you need to get it out, that's fine. But no, blind sweeping, I can't remember the exact statistic, it's somewhere between 80 and 87% of the time you will push the object farther. Infant choking. Sorry, I'm trying to go fast, I swear.
So if they're limp and, you can't get them to stand up, should you skip trying to do this?
Yep,
And go
CPR.
straight to CPR?
Yeah, if they're unresponsive, they qualify for CPR. And you should be compressing their heart anyways, and compressing their heart will also help dislodge the item. You'll do both at the same time. Infant choking is different. It is going to be 5 back blows and then 5 compressions. I don't know if you ever seen movies and stuff where they do back blows. These dummies are a little hard, so if you do comfort practice, just know they're hard. You might hurt your palm, but it's gonna be really hard. I'm gonna make a C with my hand. So if I'm sitting in a chair. I always recommend sitting. Doing it standing is really hard. I'm gonna put my hand in a C just like this. Maybe I'm not covering their mouth. I'm gonna flip them on to my forearm with their head well up below their hips so the gravity can help me. And I'm gonna hit their back directly between their shoulder blades 5 times. There's a little circle right here on the dummies that you can practice. That is the exact spot. It's gonna be really hard, really, really hard. It's gonna be like this. It's disconcerting to slap a baby, right? But we see a lot of patients every year who lose their children because they do not hit hard enough. If you think if you're with a friend and the parent can't do it, grab that baby and do it for them because it's going to save their life. And it's a paternal and maternal instinct to not be able to hit your child. So if you can help another parent, help the other parent. Find someone who can. You do 5 back blows, okay? I'm gonna grab the back of their head, I'm gonna switch them back onto my other forearm, I'm gonna do 5 compressions with my 2 fingers like this. Okay, luckily with babies, the nipple line is pretty accurate, so you can use the nipple line for babies or the arm picture we did earlier. Okay, baby goes unconscious if they can no longer flail, and they're no longer kicking their feet or their arms, now they qualify for CPR, okay? Infant CPR is, every number is the same, it's 30 compressions, 2 breaths. You can just do that 2-finger method on a flat surface, or you can do. That makes sense? Okay.
How old is an infant?
We used to say up to 1, but go off size, whoever said that, go off size. So we say up to 2 size dependent. If you feel like they have a pretty formed rib cage, they're now kind of upgraded to a child. But if they still got some pretty loose fat here with no developed rib cage, you can't really feel that liner like we have, right? That shape, then they're probably still an infant. and you can do this. Also, like, I can probably do this with you. Just based off of strength, right? So it's up to you relative to the patient as well.
So do you do the 5 and the 5 3 times?
Ignore that, sorry, I should really take it off the slide. Do it until they go unconscious. So 5 back slaps, 5 chest compressions until they go unconscious. Unconscious baby means their arms go limp, their arms and their legs go limp.
Keep doing it.
Yeah, keep doing it.
Or
Yeah,
they
just
start
go straight.
crying or kick all night, right? I mean, if they're,
They'll stop.
right, but they might not. You might get the blockage out.
Of course, if you get it out, no, with
We hope
babies,
they get the
with
blockage
babies, it's really easy to see when it's back because their color is just so, doesn't matter what ethnicity the child is, the color is so obvious. Like the color streams from their face when they don't get enough air, and it comes immediately back when they do. And it usually comes back like really red, like really red and flush. They're finally getting blood to the rest of their face. Cool. Any other questions? Thanks for letting me go over a little bit. I'm sorry. Try to keep it up. Please feel free to try on the baby. If you have children, let me know that because I want to see you do it. If you don't, or if you have grandchildren, if you work with children, please let me see you do it so I know you can do it effectively. Okay. Sound okay? All right. Other than that, I've got nothing else for you. Thanks for listening. The only thing I tell people is that try to keep up to date with these skills. Because the first time you ever do CPR, if you don't have the medical skill, will most likely be on someone you love. I did CPR for the first time on someone that I loved when I was 13. And so this is a very pertinent skill to my life, and I hope it never is for your life. I hope you never have to do it, but if you do, keep up with your training. Okay? Sound good?
Thank you. Very
Cool.
I had a baby.
Yeah, show me.
Here, so does she.
Show me. Yeah, that's it. Go sit on a chair. It's really hard standing. You
And I have
obviously, if
to-
you don't have a chair, you can stand, but
Remember to like get them so you.
Do you want the air?
yeah, that's perfect. I like to put their legs kind of straddling me. Yeah. No. Oh, yeah, I'm sorry. I didn't miss it. Just wanted to. Sorry, I told you these ones are hard.
Is it that fun though?
No, a baby's back is not that fun. That's good. I would give that a head. And when you're doing the compressions, try to, like I was holding with my hand, try to keep that head still below their hips. It helps. You might have to hunch yourself over.
This
That's
way?
okay. Yeah, so I grab it with one arm, right? So I just switch between the two arms. When they're on their back, it's like this. When they're on their front, it's like this. Make sense?
Am I sort of not going directly down that?
Yep. Yeah, you're doing it right. Yeah, you want it in and down.
Here, and then.
Yeah, perfect. Always using that C motion with your babies.
Two fingers.
Sure, right.
I would.
Real life, gotta go harder, but I want you to go hard. But a real baby is much softer. But yeah. I know.
I know. So when I'm doing the compression, hopefully never, but on a baby. I mean, it's not gonna stop, right? Not gonna get that. I've joined it a couple times. Really not.
It might. When you hit the chest wall, you'll feel it. Like you'll feel it hitting the back. You'll know. You'll recognize.
So that baby that was here, she's almost 7 months old, but she's just starting to eat real food. So sometimes she does that little AED, she's eating and all that. Is there anything you commonly see babies eat?
Oh, it's always solid.
All right.
Think of things like a baby might, right? Or they don't have the facility in order to do that. That's why most feeding is usually like over the holidays. Because they've got to be cheap. They're like, I can eat anything. And then they don't realize I gotta chew the whole carrot, you know, then they inhale a carrot, right? Carrots, grapes, because they think grapes are soft, so I can just swallow that right down. Grapes, blueberries, we see in really young kids. What's that? And then a lot of nuts. I see a lot of nuts, because they're just that perfect shape, right? They slide right into the opening of your larynx. Always encourage your child before the child you're with to cough. If you notice that they're still passing air, like they can still cough, they cough, 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 like cough as hard as you can. And if they're not coughing hard enough, do the abdominal thrusts for them. And then if they go blue and limp, you're okay. Okay, cool.
So this is like the abdominal thrust is like a scoop.
Yeah. Do you know what your diaphragm is?
Where we register.
Yeah, we're basically compressing the diaphragm all the way. It's like the air knocked out of you.
Yeah.
You're doing that on purpose. Yeah. But we want to do that as hard as we can, as fast as we can, so it's sudden. So it's one air. Question? Oh, yeah.
So. Right?
Maybe, yeah. So that's a unique question you raised. You go into cardiac arrest and your defibrillator is not bringing you back out of that, you might. Yeah. Your defibrillator broke.
It's brand new battery.
So,
But if you put it, it's a great question. Didn't come up with AED, but when someone is putting, do you have an external portion that calculates? Do you have one do you have like a lump?
Really?
you would feel it if you went to do chest
Yeah, if
compression.
you went to push on it.
Yeah, so if you're so pacemakers generally kind of bulge out.
Yeah,
You have
it's a defibrillator.
it's an ICD.
Yeah.
Okay.
It is.
So the ICDs, you want to put the pad a little to the side, so a little more on the side of the chest. Does that make sense? Yours, I guess, is, yours on the other side, so you're good. So you can put it here and here. Sometimes they'll be on the right based off anatomy. Usually they're on the left, but sometimes based off anatomy, they'll be on the right. So just check to make sure it's done from there. And I guess the other exception is if someone has a pain patch. I don't know if any of you have ever before, just rip the pain, the medical patch out, just toss it, to the side.
So if they had a pacemaker or a defibrillator, if it's not working, you put it back.
Yeah, so a pacemaker will not revive you.
So,
Yeah, pacemaker won't revive you. It'll just set your rate. It
so
means
if you have
that
a pacemaker.
I have a defibrillator.
it needs a certain section. Yeah, you can use pads. Yeah. You just don't want to put them directly over because the device might absorb the shock. Does that make sense? And then it won't work. It won't harm the patient. It won't like blow up the device, but it might absorb. It might absorb the shock, so that it's not shocking the heart. So you just have to move it to the side. You just don't want it directly over.
Mine was the cardiac arrest and electric. Not anything.
It's like, oh yeah, like a blockage. That's a good.
I know.
That is a really good thing. Yes, that's the AED.
And this is the one that'll tell you.
Where the AEDs are.
Okay.
It won't tell you when there's a CPR.
But you have to be. Think about, you have to be registered.
Yeah, I think you have to, no. You don't have to be. Your AED have to be registered in the system for people to know where it is.
Oh, got it.
No,
Okay.
you don't have to
I was
register.
like, how am I
No.
personally gonna get
I don't even
associated with
have
that?
a counter.
Okay,
Like
so
log
just,
in and it's there.
just
Yeah.
as insane, okay.
I had never registered an AED, so I might look into it. I think you can just register it and report that you have one to the city, and then you just have to, in 2 years after you upload it to the app, it'll be like, have you done your bi-yearly check? And then if you don't hit yes or no, if you never answer that question, it'll take yours off, because it won't know if it's been checked.
Yeah.
Yeah.
Okay.
I'll find that thing
Yeah.
out. Think of that.
And he said something about registering.
When I.
Yeah, I was gonna ask him to write it down. Okay.
I repeated.
Yeah, if you don't.
He did experience. The baby lives.
That was my first job.
I would even recommend it. You can get, I feel like I can get more strength doing this personally, but if you have to just try it, because there are some hard.
Hard, like, that's shocking. That's why.
They just don't know, relax, relax your stomach. Like when I did the